The surge in cases after a holiday backlog, the CDC now reporting more than 440,000 new COVID cases on Monday alone. That is a record for a single day. This comes amid new questions about rapid antigen tests and whether they may be less sensitive to Omicron. Inez de la Cuetara with the latest.
In state after state, this is the scene at testing sites.
I was looking for a test about a week ago. I have symptoms, so I just wanted to make sure before I could go back to work. That's all. Make sure I'm okay to head back to work. 5 states currently reporting more new COVID cases than at any other point in the pandemic. Cases in Florida, Georgia, and Washington, D.C. tripling in the past week. Experts now forecasting we'll have lost 863,000 American lives to the virus by January 22nd, with the U.S. now averaging more than 240,000 cases a day. This as the CDC shortens the isolation period for asymptomatic Americans infected with COVID-19, cutting the isolation period in half from 10 days to 5 days, followed by strict mask wearing for another 5 days. But the CDC not recommending people first test negative before coming out of isolation. CDC Director Dr. Rochelle Walensky defending the decision on GMA.
And we do know that the vast majority of viral transmission happens in those first 5 days, somewhere in the 85 to 90% range. So we're really talking, if you can isolate for those first 5 days, that would be great.
And new concerns over how the new variant may be affecting children. Daily pediatric hospital admissions doubling over the last month. In New York City, public schools will still open January 3rd with new testing policies to keep more kids in the classroom.
We've come up with a new approach, and those at-home tests are going to be absolutely crucial.
Today, the White House detailing how it plans to help hospitals handle the surge, sending personnel and supplies. Phil?
Inez de la Cuetara, thank you so much. Joining me now for more on that surge in COVID cases is an infectious disease specialist at South Shore Health, which is in Massachusetts, Dr. Todd Ellerin. Thanks so much for being here.
Sure.
All right, so at a White House briefing, and I'm sure you're aware of earlier on today, the administration discussed how it will help hospitals, including deploying more than 2,000 federal personnel, 1 million gloves, and nearly 350,000 face coverings and thousands of ventilators. The question is, that's all good, and hospitals certainly need that, but does it come a little too late for the particular surge we're in?
Phil, I think this is really important. Let's face it, this is the most contagious that COVID has been since the beginning of the pandemic, right? Omicron is the most contagious variant. So we have a ton of staff around the country who are out, so we need help. And in fact, in our system at South Shore Health, we have about 10 National Guards that are here that are helping with, really the kind of the non-medical, non-clinical things like transporting patients, doing intakes on patients that are coming in, screening. So it is really helpful because we're feeling it like other systems. So remember, it's all about staffing, supply, and space, and this is about the staffing part. So we need it. It's not too late.
And all the support, all the resources that we just listed off, the gloves, the ventilators, that's going to really help in the coming months?
I think it will be necessary. Now, here's the good news. Remember, overall, Omicron looks like it's less severe than previous variants. We don't know exactly if that's because of the virus itself or because we have a better immune wall given all the vaccination and boosting. But whatever it is, that's good news. So the hospitalization rates are not rising as fast as case rates, which are obviously skyrocketing. So, we don't want to see more cases, but if we had to choose, we want a less severe type of variant. That's what we're seeing here. Hopefully, we're not going to have to use as many ventilators as we had to use in that first surge way back when.
A lot of talk about this since the guidelines were announced earlier this week, reducing the isolation period from 10 days to 5 days. While many applauded the CDC's move, the CDC is also facing some criticism for not including a test-out policy. In other words, you can get out of isolation without, testing negative. On GMA this morning, Dr. Walensky said they left it out because people can test positive for an extended period of time on PCR tests. So do you think it was a mistake to leave that out, or is this going to be kind of a situational thing with the variant and with specific tests?
It's a bold move from the CDC, I have to say, Dr. Walensky and her team made. If I were leading it, maybe I wouldn't have gone to 5 days. I may have gone to 7 days without testing, 5 days with testing. But let me just say something to defend the CDC's guidance. Remember, and you can see this graph here, okay? When you test positive, you isolate for 5 days. But that doesn't mean that after you come out, it's business as usual. The CDC has said for the next 5 days, you still have to mask when you're around any other person. So that's still that sort of safety net. And I think that is key. And remember, the other thing that they said is if you still have symptoms at 5 days, if you still have fevers, if you're not feeling better, you cannot come out of isolation. You have to continue to isolate till your symptoms improve or resolve and you don't have fevers for 24 hours. So I think it is important. It's bold. We'll have to make sure. We have to really, we'll have to watch the real world experience in the United States to make sure that we're not just spreading infection. But I do think overall, most patients are no longer infectious at about day 5.
The FDA has said that rapid antigen tests may not be as sensitive at detecting the Omicron variant. What does that mean exactly, and should Americans be trusting the results they're getting?
Right, important question. This is what I'm going to say. It looks like it may be less sensitive for any one time that you use it. So what I'll say about rapid testing is you want to use it at times when you don't have access to the PCR, or if the PCR is going to take too long to come back and you have an important event or a flight, or you need that result. But you want to try to repeat that either within 24 or 48 or 72 hours. When you get more than one rapid test, that increases the accuracy more than just a one-time rapid. So I think that's the key. Let's face it, PCR is more accurate, but it's tough to get right now, and it's taking a while to come back, so it's not necessarily practical.
Quickly, before we let you go, 5 states are currently reporting more new cases than at any other point in the pandemic. What do you think the trajectory looks like in this country over the next few weeks? Will the numbers subside anytime soon, or could New Year's Eve cause more cases in the coming weeks?
So, Phil, we know what the trajectory is going to look like. It's already built in. We have major holidays, and some of them are still in front of us. We know that cases are going to rise significantly. I won't be surprised if we surpass 500,000 cases in a day, and it could be significantly more than that. Again, although that's concerning, of course, and we want to try to, layer in those safety measures to try to reduce that, and we know what those are, by the way. But, besides that, the good news is that we're uncoupling the hospitalizations and deaths from those cases. So that is a little more than a sliver of good news with New Year's Eve facing us soon.
We'll take any good news we can get. Dr. Todd Ellerin, thanks so much for taking the time.
You bet.
Hi, everyone. George Stephanopoulos here. Thanks for checking out the ABC News YouTube channel. If you'd like to get more videos, show highlights, and watch live event coverage, click on the right over here to subscribe to our channel. And don't forget to download the ABC News app for breaking news alerts. Thanks for watching.